So vein disease is a lot more common than you think. It affects about almost 28 million people annually. These are a couple of the pictures up on the screen. These are some of the... I do. Do I need to turn it up? How do I turn this up?
Okay, that's about as high as you're going to go.
Is it? Oh, I can speak a little bit louder. How about that? Is that a little bit better? Okay, good. So vein disease, it affects a lot of people every year, almost 28 million people. These pictures on the screen here, these are reflective of a lot of the patients that I see or a lot of the problems that people have in regard to vein disease. People can have those varicose veins, which is what people oftentimes think about when they think about bad veins. You can get edema, or that's leg swelling. Skin color changes down there in your legs, and we'll talk more about why that happens. And then you can also get, these horrible ulcerations on your legs that are really hard to heal. That's all part of vein disease. Of those 28 million people, I'd venture to say about 1.7 million actually seek treatment. So a lot of people are out there with undiagnosed and untreated vein disease. Of the people that I see, the majority of the patients in my practice are women. Not to say that we don't have men who come in. So I've got a pretty good mix. So, we talked about a couple symptoms of vein disease, but what else is there? What other symptoms of vein disease could there be? Leg aching is a big one, especially leg aching at the end of the day. Bleeding veins, sometimes these veins are awful itchy. People get to itching and then they start to bleed. The skin gets really thin down there. And these bleeding veins can be awful. Veins just bleed and bleed and bleed and bleed. They can be quite scary. Some other symptoms, obviously those visible veins that you get on your legs. A nighttime leg cramp is very much associated with vein disease, as is the restless leg, particularly at night. Tired legs, heavy legs, that leg swelling that we talked about, a couple more, that skin discoloration, and then also those sores on your legs that we talked about on that prior slide. So what puts you at risk for vein disease? A lot of people like to talk about prevention and how we can try and prevent these things, but sometimes we can't prevent them. We can blame our parents, Those, yeah, you really can. Those same connective tissues that, your parents blessed you with, if they had bad veins, the chances are pretty high that your body's made of those same connective tissues and you could have bad veins. So blame your parents. Prolonged sitting and standing is really hard on your legs, really hard on your legs. A lot of our occupations, it's difficult to try and modify that, but that's something to think about. Being a woman. So being a woman is tough, and especially in regard to vein disease. Women, we have all these hormones. These hormones are terrible on your veins. So sometimes just being a woman is rough. Pregnancy. So this is my little monkey. But pregnancy is quite hard on your veins. Not only the weight of the baby, but also the hormones that are associated with pregnancy. A lot of my patients will say, I had my first baby, my veins got, they kind of bothered me. By my third or fourth baby, my legs were terrible, Yeah, that's a common thing. And I can probably blame him for a couple veins on my legs too. Good thing they're cute, that's what I always say. Leg traumas. This is Montana. I have a lot of patients who are kicked by a horse or they fell out of a tree. We're kind of rough and tumble in these parts. Car accidents are a big one, or even some of those knee surgeries. Lots of knee surgeries, all that scarring, all that repeated injury to your legs. Blood clots are another one. Those blood clots really damage those veins, and you can end up with some pretty bad veins as a result. And then sometimes it just happens. We don't know why it's there, but it's there and we got to treat it. I like to talk about, why. Why do we have these bad veins? What's going on inside of our legs, right? So your arteries bring your blood down to your feet, and then your veins' job is to bring the blood back up to your heart. And if we look a bit closer at those veins are really cool. They've got valves in them, and these valves keep the blood flowing in the right direction. So they're just literally one-way shut-off valves, and they just keep everything flowing back up to your heart. Now, sometimes when those vein valves go bad, be it family history, genetics, whatever, these vein valves go bad, the vein valves don't close all the way, and you can get some sitting and spinning of your blood in between the vein valves. We call that reflux. Kind of like you can get acid indigestion or reflux up there, you can get reflux down in your legs. A little bit deeper. If you're a patient of mine, you've seen this picture because I draw it 10 times a day, so I apologize. But I really, when it comes to vein disease, you have to kind of understand what's going on inside your legs so that you understand, the treatment and where we're going to go. So you have lots of veins in your legs. You've got these deeper veins, these little connecting veins, and these more superficial veins, right? And then we kind of talked, well, the skin's kind of out there, so if we're thinking about it, we're kind of looking in underneath the skin, right? These veins have valves in there, lots of valves. Probably every 3 to 5 centimeters in your veins, you've got a valve. Those valves, sometimes they go bad, like we mentioned. You get that sitting and spinning of blood in there. That sitting and spinning of blood, it kind of puts pressure on your leg. I kind of liken this, I think the next slide, it's like a raging river, right? So if you've got a river that's all dammed up, you get lots of flooding. That flooding is what you can see and feel on your legs in the form of those varicose veins. So lots of sitting and spinning of blood, lots of pressure in your legs, lots of leg symptoms, and then oftentimes people get really bad varicose veins because it's just flooding off of that really bad vein. Does that make sense? Yeah. So that's kind of what's going on underneath the surface. So you have bad veins. What the heck are we going to do about it? That's kind of the golden question, right? A couple of things I like to talk about. Conservative measures are big on veins and vein disease. I put together a little handout called Healthy Leg Tips, and it's available at the registration desk, and we'll kind of go through that with you right now. These handouts are also available on the website, and we'll talk about how to get the website when we're done. So let's dive right in. There's a couple of things you can do. The first thing on the list is wearing compression hose. These compression hose, I'm just going to say, I wore my compression hose today. I want to start off by saying that compression hose have come along. Oh, Mark's demonstrating his compression hose in the back. Very handsome. So we have a lot of grandmothers in the audience, but they're not your grandma's hose, and I know you guys know what I mean by that. Back in the day, compression hose were very hot. They were sticky. They were uncomfortable. They were itchy. They were awful. But, years later, I love my hose. They've really come a long way. They're breathable. They use different fabrics. They're more hypoallergenic for you. They come in all kinds of different lengths and styles and thicknesses. And anyway, so I want you to keep an open mind when it comes to compression hose. So these compression hose, how the heck do they work? So what they do, if we think about those bad valves that we talked about, and those valves are kind of spread apart, that blood is kind of sitting and spinning in your legs. It's not getting back to your heart. What these compression hose do is they put a little pressure on your legs so that they mimic what your body should be doing naturally. It gets the blood back up to your heart. It puts some nice, gentle compression on your legs and squishes that blood back up to your heart. Does it fix anything inside your veins? No. It's more like a Band-Aid, but it can really make a difference and make your legs feel a lot better. I want to talk a bit more about how these work. So a lot of people will think that they've worn compression hose before, like after surgeries. People are really familiar with those white socks you wear after a surgery. They're called TED hose. They work a little bit different than a compression hose. Those TED hose, they're kind of like a big tube, right? You get the same amount of compression at your ankle as you do into your calf. And some of those TED hose, those white socks, will even go up to your thigh. But it's like a column. TEDs are for beds, we say. Those TEDs are only for after surgeries, things like that. These compression hose are cool. They work a little bit different. They give you more compression at your ankle and then less compression as it moves up your leg. So again, it mimics what your body should be doing naturally. So those TED hose, they're really uncomfortable. They can be really binding. But these are kind of fit for you. We fit and we measure you for these hose. And they should feel pretty good. Not everybody loves their hose. But when you get used to them, they make your body feel good. Go ahead.
What is the name of those hose that you said?
Oh, so they're called compression hose.
I don't mean the compression, that other.
Oh, TED hose, TED hose. Yeah. We got to repeat for the satellite site. So the question was, what were the name of the other hose that we were talking about? And those were the TED hose that you wear after surgeries. See, Mark. So yeah, TED hose, and those are pretty common after surgeries, but they don't work the same as compression hose. They're not as good for your veins, shall we say. Those are more to prevent like a blood clot in your legs after a surgery, so they just work a little bit different. And again, they can be pretty binding because they're not fit for you. They're kind of off the shelf, as you would say. So these compression hose, we kind of looked and look, do you like that? Look, eyes, yeah, I like that too. Anyways, so we looked at kind of how they work. The other thing that I really want to point out is the strength of these compression hose. So you can go to Walmart or you can go to the grocery store and you can get a pair of support socks, right? Those support socks that you get over the counter, they're not as strong as what you would get as like a prescription grade. They're measured in millimeters of mercury, which is just how much stretch it's giving you on your leg or how much compression it's giving you on your leg. The things that you can find over the counter, the strengths that you can find over the counter are like 0 to 10 and 10 to 20. Typically, the prescription grade where I put my patients in starts at 20. So 20 to 30, 30 to 40, even a 40 to 50. The majority of my patients, I do put in a 20 to 30 because I think that's probably the most tolerable level of compression. The patients that I put in the higher grades, like the 30 to 40, I've never put someone in a 40 to 50. That would be, they wouldn't like me very much, I think, if I did that. But those are the folks who have leg wounds, ulcers on their legs, horrible leg swelling. Those are the people who really need that really high level of compression in their legs. So 20 to 30, that's what I've got on today. It should make your legs feel great, and that's where the prescription grade compression hose starts. Oh, go ahead. That's a good question. So the question was asked, do these compression hoses cut off your circulation? So I had to repeat it for the satellite site, sorry. The answer to that question, so a lot of people with vein disease also have artery disease. So again, arteries bring your blood down to your legs. Veins bring your blood back up to your legs. Lots of people have mixed disease. So in folks who have mixed disease, so their arteries aren't bringing the blood down to their legs, I might back off on the level of compression. So instead of putting them into 20 to 30, I might say, you know what, 20 to 30 would be ideal, but they're not going to tolerate that because if I'm squishing that leg so bad, the arteries are already having trouble getting the blood down there. I don't want to squish that anymore. So I might put somebody in like a 10 to 20, a really light compression. So it's pretty common to have, mixed disease between the arteries and the veins. Did that kind of answer that question? Yeah. Go ahead.
Some days you can wear the 20 to 30s and others. Now, earlier today, my day starts real early. I have it on, and all of a sudden the pain got so bad that before I came here, I switched to a lighter.
So the question was asked.
But see, I've been wearing that same pair. Yesterday, it didn't bother me at all. But today, I could feel it felt like it.
Really squishing on you? Yeah. So the question for the satellite sites was, how come some days my compression hose might feel tighter than other days and bother me more and have to wear different hose day to day? My best guess would be, leg swelling. Were your legs swollen, more swollen one day? Were you on your feet more one day versus the other day? Yes. Oh, go ahead.
Do these hoses help prevent spider veins?
They do. The question was, do they help prevent spider veins? Absolutely. They definitely do. Anytime I tell my patients that, the more compression, the better. The most tolerable level of compression, the better, obviously. I always say that. And the more you can wear them when you're at risk. So when you're going to be on your feet for long hours of the day or sitting for long hours of the day, make sure you have your compression hose on. If you really don't like your compression hose, which I do have several people who really don't like them, I say on during work time, off during playtime. If you're going to go enjoy your family, go golfing, go do something fun, don't wear them if they're really going to bother you. If you want to go outside and have a good time, you don't wear them. But if you're going to be on your feet, if you can wear them at least 5 days a week, you're going to get way more benefit than if they sit on your shelf. Go ahead. They do, yeah. The question was, do they come in pantyhose fit? I prefer a pantyhose fit because I have fluffy thighs. And so I do prefer a pantyhose fit, but I've worn all the various lengths. They come in a knee high, they come in a thigh high, and then they also come in a pantyhose fit. I did bring a ring sample. I will show you guys a couple things. So the fabrics, there's a lot of different fabrics, and afterwards, if you guys wanted to come feel some of these fabrics, feel free. They make a nice men's sock. They make more athletic type socks. And then they also make more sheer, more feminine socks. Some of the socks, they have lace on them, which is kind of nice. You don't feel like you're putting on a medical device when you're putting them on, because they're kind of pretty, which is kind of nice sometimes. And then the other thing is, a lot of my patients also have arthritis. So these socks are kind of hard to get on, and people worry about how they're going to get them up. So they make handy-dandy devices. This is called the Big Butler. How about that? It also comes in like a mini butler and a baby butler, and they're kind of cute. But anyway, this is the Big Butler, and essentially what you do, let me put this down. Essentially what you do with this is you put your sock on this, and then when you're putting your foot in there, you put your foot in and it pulls up your sock, so that if you're having trouble getting down to your ankle, you don't have to bend down. It makes it easier to grab a hold of that sock and kind of pull it up. So they make devices like this that are really helpful for people. There's a couple other things they make, which I'll grab. This is kind of cute. This is called a slippy gator. How cute is that? This is I know it's hard to see from where you're at, but there's a mat in here. And it's kind of a rubbery mat, and you put this on the floor, right? And then it comes with this slip sock, and this slip sock, oh gosh, sorry, Mike. This slip sock has a couple handles on it, so you essentially put your hose on here, thread your hose on here, and then you can hold onto these handles and pull up your hose. So there's a lot of adaptive devices out there. People really worry about their hands and their arthritis. So that we can work with that. There's things that we can do. There's another thing. Let me show you one more thing. They also make lotions. It's a fitting lotion, so it makes your legs kind of more slick. Yeah, that's a good, thank you. I was looking for a word. So it makes your leg a little bit more slick, so you can pull up your hose a bit easier. So there's whatever issue you're having, there's a lot of solutions out there. Oh, go ahead.
This might be not along the same line, but is it best to wear those or not to wear them while you exercise, such as walking or on the treadmill? Is it best to have them on?
Good question. So to repeat it,
Better for your legs?
right, better for your legs if you wear them during exercise and walking. I have a couple patients who tell me that they get too sweaty when they wear their compression hose while they're exercising. I have other patients who say they can't exercise without them. So I think it's really individual. If you're going to be on your feet, if you're going to be walking all day long, it's certainly better for your legs, but whether you can tolerate that or not is so individual. But it's a good question. I think it can.
Negatively to your legs?
No, it wouldn't. You can exercise with your compression hose on. The best times to wear your compression are from sun up to sundown. I have been known to sleep in my hose. They don't give you the most benefit at night because you're not on your feet, but sometimes they make your legs feel really good and you don't want to take them off. So it's not going to hurt you. You can't overwear your hose, long story short. I don't think my husband ever liked that, but that's okay. Go ahead.
Does it matter what length you wear?
Oh, does it matter what length you wear? Sometimes it does. Sometimes it doesn't. So say you had some veins that were bothering you in your thighs. I would probably want you in like a thigh-high compression hose just to help compress where the issues are. Then again, if you're having leg swelling and veins in your thighs that are bothering you, or like kind of a mixed bag, again, my one-liner is some compression is better than no compression. So if you really don't think you can get into a thigh-high, or I have a couple of patients who just the compression on those veins hurt, so we put them in a knee-high, and they really do feel better overall. It's so individual. But I wouldn't say that one's better than another, to try and answer your question. Yeah. Go ahead.
Okay, does someone have to come to you to decide what kind of pressure they need, whether they need the 20 to 30?
So the question was, do you need to come in and kind of help determine? Oh, yeah, I can try and speak louder. You betcha, sorry, thank you. I'm kind of soft-spoken. I'm a chatty Cathy, but I don't want to speak up. So The question was, do they have to come see me and decide if, what level of compression you need to be in? I don't think you would need to. If your legs are bothering you, feel free and let's put you in some compression hose. The thing about compression hose that I'll forewarn you, there's lots of places online that you can get compression hose. The thing about compression hose is it's all about a good fit. If you don't have a good fit, you're going to hate your hose. So if you're going to go out on your own and get some compression, make sure you follow the guidelines of how to measure your leg, and make sure you really look at fit. What's nice about coming in to my office is we can fit you in the office and kind of work with you a little bit, and also work with the supplier to kind of get you in a pair of hose that fits you real good.
Does the doctor do you have to have a doctor recommend that someone go to you?
Right. No, you don't. You can self-refer. The question was if you needed a doctor to come and see me. No, you can self-refer. And I'll put my number in here a couple of times, and on the handouts there's a number. So if you or somebody you know, or your mom or dad, or whoever, just come see me. Typically what I do when I get you into my office is I'll get an ultrasound to really look at those veins and see where the problems are. We'll get you into a good pair of compression hose if you haven't already been wearing them. And then we talk about a plan, how are we going to treat you? And we'll get into some treatments here in a minute. Any other questions right now? Go ahead.
When you're taking on airplane flights,
Mm-hmm.
the knee heights are suitable,
Mm-hmm.
I'm assuming, because I've done that.
Right.
But you can get some that have a open toe.
Yes,
Is that suitable?
totally.
Then you can take your shoes off with your toe.
Yeah. So, and you can kind of wave at people. No, I'm just kidding. So the question was, are open toe compression hose okay, particularly when you're flying and things like that? So a lot of people really like an open toe because they don't want stretch on their toes, and they feel like their toes are kind of get bunchy with the compression hose. So an open toe is kind of nice. It still gives you the same amount of compression. It hits you kind of, here's your toes, it hits you kind of, after your toes there. There's pluses and minuses to both, and it's kind of a personal preference. The open toes are easier to get on. They're easier to pull up, which is kind of nice, especially we talked about people with arthritis in their fingers and things like that. And then some people have hot toes. Not like cute toes, but they get warm. They get warm toes, right? And so they don't want, just more on their feet. So open toes are a good option for people, yeah. Any other compression hose questions? I could talk hose all day. Go ahead.
Most of the time, the hose is fitted,
Mm-hmm.
but the waist is so small. It's tight, and I can't stand anything tight.
Yes.
And that is the problem. Have they changed that?
You know,
So now you can get the waist size as well?
so the question was about the waist fit for a pantyhose fit and being kind of tight on the top. There's a couple people who I honestly don't recommend a waist fit hose for. People with, so my hose, you can't see them, but they come up to they come up really high, So people with really bad acid reflux, so they get really bad indigestion, I don't recommend in a pantyhose fit, because if you have more pressure on your abdomen, it tends to make that reflux worse. So those are people I definitely don't recommend going a waist fit. I think that the waist fits now are a bit better than they used to be. Compression hose have really come a long way. We even have some, we call it max sizing, so they're just a little bit bigger overall sizing that are a little bit more generous in the waist. So there are different sizing options available now, if that helps answer.
And the other question I found is buying a men's size
Oh,
pantyhose
Mhm.
rather than a women's helps.
so
because the waist is
the waist is bigger. So the question was buying a men's versus a women's compression hose for the sizing difference. And some of them, like the men's compression socks, have a little bit more generous room in the toes, which is nice. Men tend to have bigger feet. Not me, I was blessed with big feet. But, men on a whole, they tend to have bigger feet. So sometimes it's nice to have that roomier toe with the men's sock. Most of the socks nowadays are unisex, So hopefully that helped. Any more questions back there? Go ahead.
Can you get them removed, like a surgery?
Yes, absolutely. So he asked about vein treatments and if you can get your veins removed. We'll go through these conservative measures, and then we'll talk a little bit more on the vein treatments, and we'll get into a little bit more detail about what definitive treatments we do for these veins. Yeah. Maybe we'll jump into that. We'll go through a couple more of these conservative measures. The other thing you can do is proper weight and exercise. The best exercise that you can do for your legs is a nice walking exercise. So sometimes you'll hear about, we talk about like a calf pump, right? What is that? So I shut that down. I'm going to squirt that at somebody. So your veins are kind of flimsy and floppy, right? And they're housed kind of inside the muscle area. So if you can really strengthen your muscles, particularly your leg muscles, it can really help propel that blood back up to your heart. So when we talk about a calf pump and strengthening your calf pump, we're talking about walking exercise, leg exercise that can really help your legs. A couple more. High heels. So avoid wearing high heels, of course. Wear a sensible low-heeled shoe. And then if you're going to wear a wedge like I did today, or even a kitten heel, make sure you wear your compression hose with them. That can really kind of counterbalance the heel. Elevating your legs. So I was just telling Dr. Yandel this morning, every time I think about elevating your legs and I tell a patient to elevate your legs, I think about my dad. That's my dad. We go fishing all the time. Anyways, when I was a kid, he used to come home and he would say that he was going to stick his feet up around his ears every day like clockwork. So when I think about elevating legs at the end of the day, I think about my dad. But anyways, if you get your legs up, even throughout the day, it can really help promote that blood return back to your heart. And then the last thing on here is avoiding that prolonged sitting and standing, which is hard sometimes when we're working. Sometimes you just can't get around it. Or if you're out volunteering or whatever you're doing, you can't always just sit down for a while or change it up. Okay, so I hear this all the time. We're going to talk about vein surgery and vein treatments. So these are common conversations that I hear about. So, Mom, I need vein surgery. Oh my gosh, Aunt Martha did that and it was terrible. And she says, peace be with you. And you're like, thanks. And then they come to me and they say, what am I in for? This sounds awful. Give it to me straight. What I want to tell you is I will be the first to tell you that I hate needles, right? When I got my flu shot, my medical assistant had to hold my hand while I cried, okay? So I don't like needles as much as anybody else. So I completely empathize with that. My job as your healthcare provider is to make you feel comfortable. I want to tell you that these vein treatments and these vein surgeries, they're not like they used to be. They're way easier. They're not these big horrific things that I'm sure you guys can remember hearing about your aunts and your uncles and things like that having to go through, having these horrible incisions and surgeries. It's not that bad. You know, I like this quote. A wise physician said, the best medicine for humans is care and love. Someone asked, well, if it doesn't work, he smiled and said, increase the dose. So I'm telling you, my job is truly, I empathize with you. I know it's scary, but these treatments we have nowadays are heads and tails better than they used to be. These are really easy things we can do. So let's jump into them. Okay, so these are also flyers that are available, and feel free to grab them on the way out, or if you have them now, you can follow along. So I want to talk about like the goal of vein treatment, right? So the overall goal is to shut down the vein that's not working right, and then your blood will kind of be rerouted through your good veins in your leg. I kind of liken this, whenever I talk about this kind of a concept, you know, I think about like a highway map, right? So if we were going to go to Helena or Bozeman or wherever, you can get there on the highway, you can get there on the frontage road, and I'm sure you can get there on all these side roads, winding roads, back roads, right? So if you think about vein disease, think about your highway's working okay, right? But your blood is hung up in road construction on your frontage road. It's just not getting there, right? It's frustrating. So what we're going to go do is we're going to shut down that frontage road, and your blood will be rerouted through your highway, you know? So by shutting down one vein, people worry about, well, what's going to happen to the blood? It's going to flow more effectively back up to your heart is what it's going to do. And then overall treatment goal is, well, my legs look and they feel a heck of a lot better. So that's the kind of goal of these treatments that we do. So specifically getting into treatments now. So we talked a little bit about the compression hose, right? And then, you know, these other treatments I want to focus on are these middle three, right? The radiofrequency ablation, the Clarivein, and then the vein stripping. The vein stripping are like the horrible surgeries of the past, right? We don't do a lot of vein strippings. Vein strippings have come a long way, and we still do some vein strippings. There's still a time and a place, but by and far, we don't do a lot of vein stripping. So I don't spend a lot of time talking about that vein stripping. Where I want to spend our time today is talking about these other modalities of treating your veins. So the radiofrequency ablation and the Claravane. What these procedures do, again, is we shut down that vein that's not working properly. The RFA, the radiofrequency ablation, I should get my pointer, huh? What that does is it uses heat to shut down that vein. This Claravane uses a medicine to shut down that vein. Both of these procedures, they have about the same efficacy, or they work about the same success rate. I think the success rate of each is right up in 94% at the 2 and 5 year mark. Success meaning that vein that we treated is still shut down. It hasn't reopened or anything like that. The procedure was a success then, is what they say. When it comes down to picking one procedure over the other, the big thing that we talk about is cost. Cost is a big factor for people. Anything that's a little bit newer, so this Claravane is a little bit newer, it's not always as well covered when something's new. So right now we tend to do more of these radiofrequency ablations just for cost reasons. There's not one that's better than the other. But I do want to kind of go through these here a little bit. So what we do when we do these radiofrequency ablations, and I brought a little kit with me. Just a second. Okay, so what we do is I give you some medicine, right? Some pills that make you feel nice and relaxed, and some people take a nap, and other people just feel kind of good, and then they're ready to do this. So we basically, using an ultrasound, we find that vein that's not working right, and we start an IV in your leg, right? So you have one little poke hole where we start an IV in your leg. We use numbing medicines. You might feel a little bit of poking, but by and far, it's not a huge surgical procedure. You're awake for this, or you're, in happy land taking a nap. And then what we do is we thread a little device, and you guys can feel free and play with this later. But we thread this little device up through that vein that we started, or that IV that we started in your leg. The tip of this catheter has a heating element on it, and it heats up. So we literally cook the vein from the inside out. You guys don't feel the heat. We put a lot of numbing medicine in there so that the procedure itself is relatively pain-free once we start heating up this vein. We pull this out. We put a couple steri strips, or those white tape strips on your leg. You'll have one big poke hole, big as in pencil eraser sized. That's pretty relative. And then you're on your way. There's no big incisions in your legs. It's one little poke hole. It's a very well-tolerated procedure, and people often go back to work the next day. The other one here, that Claravane, I do have a little catheter to show you on that too. Maybe. I can get it open. So again, same concept. We start an IV in your leg, and then we thread this little guy. It's pretty teeny tiny. We thread this little guy up your leg, up through that IV, and then it has a motor on it, and we turn it on, and the tip of the motor spins and sprays medicine inside your vein. So it's pretty cool what we can do. And again, we take that out, we put a couple steri strips where we went in, and you're treated. So it's very well tolerated. I do have a couple quick videos so you can kind of get the concept a bit more. We'll see if they play. This is always the fun part. I think I have to click on it. This is literally 2 minutes. Maybe, maybe not. If it doesn't work, it's not the end of the world. I don't think it's going to work. That's okay. Well, all that little video did was kind of go through a 2-minute quick explanation of kind of how this works. That other video did the same thing. So, moving to this end of the spectrum where you see that ambulatory microphlebectomy, that's a big word. Sometimes we just refer to it as phlebectomy. That's literally where we make little tiny poke holes, and we use a little crochet hook. You guys are probably familiar with those. A little tiny crochet hook, and we just tease out those veins that, those varicose veins that are really bothersome, right? The other one up there is that sclerotherapy. That's a lot of times more cosmetic for those teeny tiny spider veins on your legs. We inject a little bit of medicine in them in the office. A lot of times they need repeated treatments for that, but it can be very effective for the treatment of those little spider veins.
Is that considered cosmetic surgery?
So the question was if it's considered cosmetic. Sometimes the sclerotherapy is, and sometimes it's not. My job as your provider is to work really hard with the insurance companies, and they love me, I'm sure, but we work hard with them to try and get this covered for you. Certainly this middle section, the RFA, the Claravane, the vein stripping, definitely a medical necessity for people. Sometimes it gets a bit dicey when you get into the sclerotherapy, but that's my job to try and figure out for you guys. A lot of times it's what you document and how you document to get some of these things. You know, if your legs are really bothering you, these are horrible itchy things, I mean, that's obviously something that needs to be treated. So my job is to convey that to the insurance company that I feel this really needs to be done.
So you're saying that Medicare may pay for something?
Yes, so this middle section for sure. As long as we do these conservative measures that we talked about, those healthy leg tips, Medicare oftentimes requires either 6 weeks to 3 months of these conservative therapies. They do that, I think, for a number of reasons. A lot of people, you know, I would say when I see patients back for their follow-up, I've seen them once, we've established they have bad veins, we put them in compression hose, and I see them back in either 6 weeks or 3 months. Probably 90% of those people, they want to proceed to a treatment. You know, they say either my compression hose and all your healthy leg tips help my legs or they didn't, but either way I want a more definitive treatment of my veins. The other 10% come and see me and they say, you know, I love my compression hose. I can work with these tips. I don't really want to do a procedure right now. Let's hold off. So I kind of think, you know, insurance companies bank on that 10% that kind of want to hold off for a little bit. There's nothing wrong with waiting. A lot of times these procedures are not emergent. We can kind of work with your schedule, you know, and get them in when you have time to get them done, you know. So that's kind of the process. But yes, they're typically well-covered procedures.
Well, if it was kind of an emergency or you're really having a problem, does Medicare still recommend this compression hose 3-month period? Or?
So the question was how we get around that Medicare 3-month compression hose period. There's a couple ways we do get around that. One is if somebody has had bleeding varicose veins. When these veins bleed, there we go, that was tough. You know, it can be really scary. You know, they bleed and bleed. There's high pressure in those veins. And if you've established that they've bled more than 3 times, then we can bypass that 3-month wait period. The other thing is ulcerations on your legs, sores on your legs. If you have a sore on your leg, we can skip straight to treatment. Or if you have history of having a sore on your leg, we can skip to treatment. Aside from that, it's difficult to kind of bypass that time frame. Go ahead.
On that Claravane, you said that the insurance companies, especially like Medicare, they don't always allow.
So it's a new therapy. Anything new, they don't always want to accept it right away. Just very recently, Medicare came out with another policy that sounds like it's going to be more accepting of this Claravane, which is exciting for me because I like to give people options. So I think that'll be an evolving thing over the next few months.
Well, my sister, my little sister, just
Mm-hmm.
they're working a lot on it, not so much for her.
For her, yeah.
But how about, does it take any of the looks away either one of them?
Oh,
I
yeah.
noticed it on my left leg, but right there.
Sure.
I mean, does it actually reduce some of the bumps?
That's a great question, actually. So the question was, do some of these therapies reduce the bumps? I want to go back. Remember when we talked about that raging river analogy? So these treatments are going to treat that raging river. And with that raging river, you had all those flooding, those varicose veins, right? So if we've now treated that raging river, a lot of those little tributaries are going to start receding. If you look at the research with these, at the 6-week mark, 70% of those tributaries, those varicose veins, will have receded after one of these treatments. So that's pretty significant.
Have you ever done the first or the second one, and also the one for the spinal vein?
Right, so the question was, do we do a lot of the middle ones, and then as well as the phlebectomy and even some of the injecting? Yeah, we do. You know, some people, this is America. Sometimes we want it now. We don't want to wait 6 weeks, you know? So for some people, if they've got a really bothersome varicose vein, like driving them crazy, keeping them up at night, they say, you know, let's do one of these procedures, either the heat procedure or the medicine procedure, but can we please also take care of that vein? And I say, yes, absolutely. I want you to be the happiest with your care and the treatment of your legs. Medicare will pay for that at the same time, too. Some people do choose to delay that because they don't want extra tiny micro incisions on their legs and things like that. But yes, we can do them at the same time. Mm-hmm.
There's a question I have about my legs in general, but
Mm-hmm.
are dark.
Oh,
And, mostly from the back of the calf on down.
yes.
And I've had this for several years.
Mm-hmm.
And I really don't know whether that falls into your bailiwick here or not.
Mm-hmm.
Could you please explain it?
Absolutely. So the question was when you have that darkened skin coloration on your legs, what that might be. So if you've got all this arterial blood going down to your legs, but your veins aren't doing a good job at getting the blood back up to your heart, you can almost think of like a swamp, right? When you go to a swamp, it's kind of squishy, right? The ground is kind of squishy. Your legs kind of get like that. So you get all this blood down there, and it doesn't come back up, and the tissues can get a little bit squishy, right? That blood down there is kind of leaking into the tissues, and it can affect the way the tissues look. The bits and pieces of your blood, it's actually called hemosiderin staining. You can get little staining down there. It's the heme in your blood. All that blood sitting down there, and the heme kind of turns your leg kind of a different purpley, reddish kind of a color. So that's very much an indication of vein disease. Yes. I'm glad you asked that question. And that's the same thing when... Yeah, how we would treat that is we would find out where those bad veins are in your legs and then pick one, of course, get you in your compression hose, and then pick one of these procedures to treat you. Mm-hmm. A lot of times that staining doesn't all the way go away. You know, some of that staining can be kind of permanent. I have had a lot of patients tell me that it got a lot lighter. That staining got a lot lighter. It wasn't as purple or red or brown. Brown's a good description. Yep, it can get kind of brown sometimes. Yeah, and that's how those wounds open up too. So if all that blood is kind of squishy down there, it affects the skin integrity, and that's why people can get ulcerations down there, wounds on their legs, because the tissues just aren't healthy tissues. You know, there's just it's too wet and swampy down there, for lack of better words. Yeah. Go ahead. Yeah, so the question was cellulitis, if that's anything to do with it. So cellulitis, that's when you get, leg swelling, you get kind of an infection in there in the tissues. A lot of people with bad veins get repeated episodes of cellulitis because your legs are so swollen and they're always swollen. And those bugs, they really like to grow in those wet, moist, swollen places. And so a lot of people will get repeated episodes of cellulitis. So yes, they're very much linked together. It can be a very frustrating problem for people. Yeah, and people end up in the hospital all the time for their cellulitis. It's difficult. Yeah. What else do I have on here? Oh, results. So let's look at a couple pictures because this is always fun. So these are a couple before and afters, but I want you guys to get an idea of what is conceivably possible. A lot of people come in and they're like, my legs look awful. I don't think you could make any difference. But yes, people can have great results with all of these therapies. We'll look at a couple more here. These are those little tiny spider veins. It's a little bit fuzzy here, but spider vein treatments, some more big bulbous veins there. I'll get out of the way so you can see. But people can have really great results. Not only do your legs look better, but the most important thing to me is that they feel better. You can go out there and enjoy your life. That's what's important. More spider veins. Those big old roping veins there on her leg. And then the last one's a wound. I think wound treatments are probably the most gratifying because some of these people have had wounds for years and years and years, and they either heal and then they open back up in the same spot. It's really difficult to treat these wounds. So some of the most gratifying people that I meet are patients where we can go in and we can treat their veins, we can heal these wounds so they don't come back. That's a big deal. Some of the people who do veins with me, I thought it would be nice to talk about them. Dr. Bland, he's an interventional radiologist. So he works all day on accessing blood vessels and doing things like that. He's a great guy. I really enjoy working with him. Dr. Hancock, he's a general surgeon and a vascular surgeon. He's been doing veins for a number of years. Dr. Maxfield, she's a vascular surgeon as well, and she's awesome to work with. Dr. Mark Marash, we were lucky enough to steal a few months ago from a different organization, and we're very happy to have him. He's done veins for a number of years, and he's a very intelligent man. Dr. Yandel, he's got aspirations to do veins, but he doesn't quite do them yet. And then, of course, I'm up there too. So if you're out there thinking, this is great information, but you know, how do I either get a hold of Angela? How do I get in contact with you? What do I do? So you don't need a referral, like we mentioned. You can feel free to phone my office. That'll get you my nurse in my office and say, you know, I was at Angela's talk. I've got terrible veins and I need some help. You can refer a family member, whatever. You don't need a doctor referral to come and see me. If you want some more information, our website is great. On our website, you can find out those videos that I tried to play. They're on our website, so if you really want to go watch them, it just kind of goes through the treatments a little bit. And then there's also more handouts on our website as well. So what I typically have you up there for is an ultrasound where we look at your legs and we try and see a bit deeper than what we can see on the surface, find out where the problem is. That ultrasound can take from a half an hour to an hour. You know, they really take a good look at your legs. And then you'll come up and see me either that day, we can do it all in one day, or if you know you're short on time, we can do it a different day. But I like to sit down with you guys and talk with you. I usually take about 45 minutes and sit down. We talk about your legs. We talk again about vein disease. And we kind of make a plan for what we're going to do. If you need compression hose, I have a little boutique in the office with some compression hose right there. We can get you set up with some. Or if we need to order them, we'll get you fit and measured and get you set up. So that's why I tend to take a lot of time.